Now, the top issue in this race with Tina Smith is women's health. And I want to make changes in the Minnesota Democratic Party in this area and go to Washington and help lead this nation in a completely different direction on women's health care than Smith and Klobuchar are doing. The other top issues are community development, which includes the economy, including mining. The COVID opening, of course, is a very big issue. Education, policing and police funding, that's been a big issue here in the Twin Cities and probably in Duluth too. Security and trust, foreign alliances, especially East Asia, China, Taiwan, Hong Kong, and supporting the defense preparation. So in the area of women's health care, while the media has failed to cover it and the numbers are less than the horrific abortion numbers, the top story in women's health care in this federal election 2020 is that the state of Minnesota is killing women in the federal breast cancer program to get the money, federal and matching state dollars for other purposes. So this has touched my life and that of our family since 2013 and still today. Minnesota needs to be turned around immediately and step away from stealing the cancer treatment funds dedicated by Congress to begin treating these low-income women diagnosed with breast cancer in the U.S. Senate program called in Minnesota the Medical Assistance for Breast and Cervical Cancer, or MABC. Under a bizarre interpretation by Keith Ellison, the man unfortunately elected the state's attorney general, women are aged out of their cancer treatment in clear violation of the Age Act, which forbids any denial or exclusion on the basis of age. And it violates the U.S. Constitution, and the money is taken from them and applied to younger patients, to their medical providers, leaving women in treatment uninsured by the program, and women die. Women are dying in Minnesota today and in other states because of a medical scandal my opponent, Tina Smith, has been involved in ever since she was in the governor's office of Mark Dayton. And it's one of the issues she's gone to Washington to pursue, to stop the life-saving women's cancer program from functioning. So a bizarre interpretation by the state relies on a 1982 case using the initial age criteria for the program, which excludes women who are 65 or older. And it reaches a conclusion that if a woman is diagnosed with the cancer while she is 64 and begins it, it ends when she turns 65. And Medicare will not cover these benefits. And I would, one, extend that initial Medicaid coverage under the categorical Medicaid program to age 69, which is the upper end of the so-called sweet spot for women getting breast cancer. It goes from 62 to 69, a lot of people. So I would work in the Senate to clarify, also in view of the recent case at the Supreme Court, a sense of the Senate that this interpretation must be paid attention to by the courts because it's at odds with, it violates the federal law passed in 2000, which was intended to completely treat the woman, and then the coverage would end. It's in the limitations period itself. Now, it was not, the law was passed in 2000. It was not part of Obamacare. It's a wonderful bipartisan women senators in action. Our senior women have virtually no supporters as this vengeful, silent killer takes these truly wonderful women abandoned to face the onset of cancer alone and the continuation of cancer alone. This is truly throwing Granny off the cliff. Now, secondly, the Supreme Court's terrible decision in the June Medical versus Russo case from Louisiana in the current term hits Minnesota women especially hard. A mother should not have to die herself just because she makes the terrible decision to abort her baby. Throughout Minnesota, doctors who do not have admission privileges to a hospital are currently nonetheless performing abortions. 61% of women in 97% of our counties don't even have a safe clinic. To protect the lives of women, the state needs to regulate the practice to ensure that women's lives are protected in childbirth against abortion, death, or injury. Infection, anesthetic complications, and hemorrhage are leading medical dangers to women in abortion, and no woman's life can be abandoned by the U.S. Senate. Under the 14th Amendment, states have the right and duty to protect women, as the June medical dissenters stressed. Under the new and unconstitutional Supreme Court decision, the court is left on the doorstep of overturning Roe v. Wade. I'm quite concerned about John Roberts, and especially his recent head injury on June 21st, just announced by the court. It might be time for him to retire. I know that's up to him. The court ensured that abortion will continue to be dangerous and even deadly for the mother, and this decision needs to be revisited and modified. Consistent with Minnesota's approach to defunding breast cancer treatment, the Minnesota legislature, has also defunded the Alec Smith diabetes program, meaning they will pay nothing. They won't even identify whether a person is eligible for it, so the company can pay for it. And they are eligible for very little. And I agree with Big Pharma on this, that Minnesota, in another killer disease, diabetes, has violated the U.S. Constitution by refusing to give one dime to low-income diabetes patients, instead relying entirely on state mandates placed on private companies. We need a real health disparity program for low-income diabetes patients. Education, prevention, early detection, and treatment, not just a 30-day supply of insulin, is what Congress needs to take up. Now on the COVID-19, of course, opening during and after COVID is still a big problem. And I'm grateful for the leadership of Donald Trump and his team on this and expect it to continue. China has behaved very irresponsibly in destroying samples and failing to inform the world and even the World Health Organization about the perilous nature of this new disease. In Minnesota and across the country, we have a big problem in nursing homes. We've done a poor job there. We have problems in the packing plants and other industries. And I want to work with unions to address this danger and save jobs, good, safe jobs. And it's true that minorities and low-income people are vulnerable to corona, including through employment, and we need a lot more care and knowledge there. The reopening of schools is a big part of that. This will be up to the governor and to private schools. Naturally, we'll need strict health guidelines. This is, of course, the domestic issue of the era, and we must win. Health disparities, which also are in corona, and killer diseases, such as cancer and diabetes, has always been my focus in leading federal health care reform. This started and was part of my reason for running for federal office, when instead of helping, Barack Obama completely disoriented and basically crippled our healthcare system, leaving the entire nation dependent on, quote, expanding Medicaid, and now pretending we can have universal Medicare, which, by the way, only covers 80% and excludes many critical services and medical products. By attacking killer diseases with education, early intervention and prevention, and full support for diagnosis and treatment, we can save lives and money, and this is federal money well spent. And we have to force the states to honor their commitments and obligations to the patients. This will also strengthen private coverage, so people will not be limited, so they can't use their means to attain the highest quality of life that they can. Creating these programs will increase the availability of improving and life-saving care in the healthcare market in Minnesota. More doctors, more critical infrastructure, and more patients in longer and more productive lives. So I'm talking about both private and government programs.